Hello and welcome to this week's edition of African Perspective. My name is Peter Ndoro. Thanks for joining us. We have so much on the program today, with COVID-19 being a central theme across the world and, of course, across our continent. Remember, we'd also love to hear your perspective on the issues tonight. Send us your messages via Twitter, and you can use the handle #AfricanPerspective. But first, the leader of the World Health Organization, the WHO, Tedros Ghebreyesus, says that he's received death threats and racist insults whilst running the global efforts to fight the coronavirus pandemic. Ghebreyesus has given a strident defense of his agency's handling of the COVID-19 pandemic so far.
I can tell you personal attacks that has been going on for more than 2-3 months. Abuses, or racist comments, giving me names, black or negro. I'm proud of being black or proud of being negro, because that negro is black, black is black, and I'm proud. I don't care, to be honest. And thank you for asking that question. Maybe for the first time I would make this public. Even death threat, I don't give a damn, because it's personally targeted to me. 3 months in the same situation. What makes me sad is, I said it last presser, when the whole black community was insulted, when Africa was insulted, then I don't tolerate. Then I say people are crossing the line. When it's personal, even death threat, I didn't care. I didn't even respond. When as community people start to insult us, that's enough. That's enough. We cannot tolerate that. But since I don't have any inferiority complex when I am personally affected or attacked by racial slurs, I don't care, because I am a very proud black person or negro. I don't care being called even negro. I am. That's what came from some quarters. And if you want me to be specific, 3 months ago, this attack came from Taiwan. We need to be honest. I will be straight today. From Taiwan. And Taiwan, the foreign ministry also, they know the campaign. They didn't dissociate themselves. They even started criticizing me in the middle of all that insult and slur. But I didn't care. 3 months. I say it today because it's enough. But still, they can continue. I don't care. Because what I care is when humanity is insulted, when we don't care, when we have more than 60,000 body bags.
All right, so that's a very defiant WHO Director General, Tedros Ghebreyesus, fighting back there, and has been under some criticism, particularly from the United States, which has said that he should actually get fired, and threatening also to withdraw funding to this world body. So the United Nations has certainly got its hands full, but the WHO saying that in the 100 days, I think tomorrow is the 100th day anniversary from the moment that they were notified about the COVID-19 virus. And he's saying that we've done the best we can, and that this isn't a time for politicking, but standing together. We'll get a bit more on that a little bit later on the program. But in the meantime, Ethiopian Prime Minister Abiy Ahmed has declared a state of emergency in the country to help curb the spread of the new coronavirus, COVID-19. Africa's second most populous nation at more than 110 million people, Ethiopia has recorded 52 cases of COVID-19 and has recorded 2 deaths.
Authorities have taken a series of measures to stem the spread, including closing schools, banning public gatherings, and requiring most employees to work from home. The Prime Minister did not mention what additional steps will be taken under the state of emergency. Recently, Ethiopia closed land borders and schools, freed thousands of prisoners to ease overcrowding, sprayed main streets in the capital with disinfectant, and discouraged large gatherings.
So far, the measures that have been taken include stopping large gatherings and sporting events, closure of schools, 14-day quarantine for all travelers arriving to Ethiopia, cessation of over 80 Ethiopian Airlines flight destinations, temporary closures of bars and nightclubs. As well, work-from-home measures have been put into place for government employees, aimed at decreasing public transport crowding. Additionally, closure of land borders, with the exception of entry and exit of goods, have also been one of the key measures that have been put in place. And this has been gradually monitored with the law and enforcement bodies to curtail movement within borders as well.
Orthodox Christian leaders have encouraged worshippers to pray at home, and police were deployed on Sunday to prevent large crowds from descending on one of the capital's main cathedrals.
All right, so a state of emergency declared there in Ethiopia. Let's cross the Atlantic now and go to the United Nations, where the Security Council will hold a closed virtual session tomorrow to discuss the COVID-19 pandemic. The first time that the UN's most powerful organ will take up the matter in a formal setting. The Council is also considering a number of draft resolutions that could endorse the Secretary-General's call for a global ceasefire with a focus on conflict areas that continue to undermine global efforts to combat the deadly virus. For more now, we're joined on the line by South Africa's Ambassador to the United Nations, His Excellency Jerry Machila. Thanks so much indeed for joining us, Ambassador. Welcome to the program. Can I just start perhaps by asking you how your family is doing, given that you're at the epicenter of the virus in the United States?
Peter, thanks very much for having me on your show and your listeners, and thanks for checking on me and my family. Peter, we are fine. We are, of course, working from home. I'm with my family here, and everybody's okay. And every morning I check our staff. We have 29 diplomats here, so every morning at 9 o'clock I call them, we check on them, and at 5 p.m. when they knock off, we check each other. So we have a WhatsApp group of our colleagues in the mission. So every morning we check one another, including what you call local staff. So we make sure that the staff, their families, are all right every day, and we all observe the regulations by the mayor of de Blasio of New York and Governor Cuomo of New York State. So we follow the regulation religiously.
All right.
Thanks very much.
These are unprecedented times for everybody and affecting everybody's work. How difficult has it been to be South Africa's envoy at the UN during this time and to be able to do your duties?
Well, Peter, we really try our level best. Luckily, the head office is always available. The minister, Director General, the DDGs, and deputy, everybody's available in Pretoria, given the 6 hours difference, and the president have regular directives he gives. Now, Peter, is very hectic. You can't believe how hectic it is. But of course, we have gone virtual, all of us. Security Council meets morning, afternoon. On VTC, we go through the normal processes, albeit, visual, but we can see one another through the VTC. And then there is another work program of the General Assembly. 6 committees go through. As we speak now, I think myself and colleagues who are negotiating not less than 5 resolutions running concurrently. So there is a cross lines of VTC, there is networking, there is exchange on the laptops, on our instruments, on the positioning, directing, and then sent to Pretoria overnight, getting fully in the morning. So it's still half of activities. We're not slow down. Actually, we have put the gear a bit higher because of these extraordinary circumstances caused by coronavirus.
All right. Well, let's talk about some of the work that you're doing in the UN Security Council. We believe that the Secretary General is trying to get a resolution put through to get a global ceasefire. He's put that on the table quite a while back already. But there seems to be competition between the other 10 members and the permanent 5. What is the challenge here? One would think that this is a straightforward issue, peace to try and save the planet.
Peter, thanks very much for raising that question. Secretary General has taken two initiatives. First, he called for the global ceasefire, which all the 50 member security councils in South Africa truly support. And then he has called for the Solidarity Fund to raise resources, especially to assist those countries impacted negatively or to be impacted negatively by coronavirus, like African developing countries. Now, there is a draft on the table. As we speak, I expect they've just left, of course, visually. I'm saying they left visually. That negotiating a resolution put by the representative of Tunisia, one of the A3, the Africa 3, it's South Africa, Niger, and Tunisia in the Security Council. They put up a resolution. Now, everybody agrees with the resolution. There are only 3 areas, Peter, of disagreement. Some are saying coronavirus is a threat to peace and security. Some are saying, especially among the permanent members, some are saying it is not. But it has an impact in conflict situations. Example, you can't say in South Africa is causing a threat to peace and security. But in conflict situations like Libya, like South Sudan, like DRC, like Yemen, Syria, it may impact negatively in terms of various areas. One, through rotation. When you send peacekeepers, like we have thousands of them in the DRC, you normally keep them for a period of time, then you rotate and send fresh one. But because of coronavirus, we're then asked to suspend rotation. So it impacts peacekeeping, but it's not a threat to peace and security. Sometimes in the area of humanitarian assistance, like in Yemen, if you close the borders, if you have no logistics to fly in resources, medicine, etc., it will impact on how you give assistance to refugees, internally displaced, or people like migrants. So there's a debate going on, but I think we're trying to propose a language in South Africa that will go around these issues. The second one, Peter, was sanctions. Some says, take Zimbabwe. You cannot expect Zimbabwe to mobilize global resources to deal with coronavirus pandemic when you say you cannot buy the following because of illegal sanction by America. So we say in a situation where we have countries like Zimbabwe, like Sudan, we may have to relax these measures so that these countries can have an access to life-saving equipment and resources to fight coronavirus. It's war. It's everybody's fighting. So that's one. Second area is a question of lifting of sanctions. So and the last one really is a minor one where we are some colleagues are arguing that this issue belongs to other areas of United Nations. You cannot, for example, Security Council tell WTO do the following things. Like there is a paragraph there which says WTO must do the following things, or ask member states to do the following things. They said no, that is not the prerogative of Security Council. But then if you go to the General Assembly under ECOSOC for development, you can urge member states. But Security Council cannot command the 193 member states of the United Nations to say you must have medicine, you must have...
Hello, Ambassador Machila, you still there? All right, it looks like we've lost... Ambassador Machila, you still there? All right, okay. Looks like we've lost him on the line, but I think we've got the crux of some of the issues that they're dealing with, and we're going to hear perhaps very soon, for the first time after all this time, from the UN Security Council what their position is on this COVID-19 and the impact that it's having across the continent. All right, we're going to take a quick break, and when we come back, we'll be talking to the Executive Director of UN Women, Phumzile Mlambo-Ngcuka. Stay with us for that. Welcome back. You're still watching African Perspective on the SABC News Channel. The coronavirus has flipped the world on its head and has in a dizzying spin at the same time. Borders are closed, travel and tourism have ground to a halt, and business and conference gatherings postponed until further notice as nations observe stay-at-homes and also lockdowns. And just ask the Executive Director of UN Women, for which 2020 was expected to be a highlight of her tenure. The Commission on the Status of Women largely postponed last month, and it remains unclear whether anniversaries to mark the 25th anniversary of the groundbreaking Beijing Platform of Action and the adoption of the Security Council Resolution 1325 will go ahead. Well, Dr. Phumzile Mlambo-Ngcuka joins us now via Skype, in fact on the line, just to talk to us about some of the challenges that she's facing at UN Women. Thanks so much indeed for joining us. Welcome to the program. How has COVID-19 disrupted your work and your ability to deliver on your mandate?
Peter, as you already indicated, we had to postpone the commemoration of Beijing 25. It was supposed to be the biggest CSW, and South Africa, for instance, had a very big and a strong delegation. We also had another conference, Generation Equality, which was a conference that was going to chart forward the program of action that will ensure that what we have not achieved in the last 25 years, as far as the Beijing platform is concerned, can be attended to in a much strategic and a stronger way. We have not announced the new dates, but I can tell you we will commemorate these events once we have come back to normal. So it's not cancelled, it's postponed. But unfortunately, because the situation is unclear, we cannot give a date at this point.
So many issues affecting women during periods like this. We've seen it in the past with Ebola and other pandemics. What's a big concern for you at this time during COVID-19?
My biggest concern is gender-based violence, Peter. And my biggest ask from governments and leaders is to declare the services that are being provided to support women who are affected by violence, essential services, and to do that immediately so that there's uninterrupted support and services to those women. If the services that are provided to women who are in distress because of violence are not available, that's just another blow to the women. So we would like the social workers that support the women to be there. We would like the shelters that are supporting women not to be closed. We would like to make sure that the police support and the courts that deal with cases of violence against women operate at this time. I think South Africa is doing a lot of that kind of work, but we would actually like it to be declared as an essential service so that everybody is checked up.
All right, so we've talked a little bit about South Africa. What have you been seeing across the continent, across Africa, with regards to gender-based violence and initiatives to try and assist and support women that are vulnerable at this time?
Well, because in Africa, the pandemic has not been as horrible as it has been in other parts of the world, the action and the initiatives that could be taken by governments we are not yet seeing them. But I can tell you, in Asia, for instance, where it's been 100 days since the first patient was diagnosed, we've seen a variety of actions that government have taken, from providing social protection, interventions on gender-based violence, some stimulus, but not at the scale that we expected to be. So we still need to advocate for these services. We still need to have supporters of women to stay in solidarity, and we have also to encourage private sector, youth, and other people who can be advocates at this time to support women. I also want to emphasize that women are not just victims, so we should not just see them as victims of violence. They are also providing essential service. Women are 70% of the health workers who are in the front line. They are the ones who are most
busy now. Please try later.
Because they are handling patients.
Sorry, the network is busy now. Please try later.
Public transport.
Sorry, the network is busy now. Please try later.
To infections. So women are actually in the front line saving lives.
All right, so you talked about girls and young women also being able to join in the activism. I know that in some areas like China, and I wonder if this is something that can happen here, where social media solutions can be brought to bear. All right, okay. Looks like we're having trouble with our lines to New York this evening. That was the Executive Director, UN Women, Phumzile Mlambo-Ngcuka, speaking to us there about some of the challenges that women across the globe are facing, particularly when it comes to gender-based violence during a pandemic period such as this, and that South Africa doing the right things, but perhaps to give more resources to make sure things like shelters are things that are available to our women who are in need at this particular moment in time. All right, we're going to take a quick break, and when we continue, more on African Perspective. Stay with us. Welcome back. You're still watching African Perspective. Just before the break, we were talking to the Executive Director of UN Women, Dr. Phumzile Mlambo-Ngcuka. She joins us once again on the line. Thanks so much for joining us. Sorry about losing you on the line there, but let's pick up our conversation. And one area that I wanted to chat about and often doesn't get talked about, violence comes in different forms, and cyber violence is one area also that women are particularly vulnerable to.
Yes, and we have seen it increase at this time for both women and children. We have seen, for instance, in the Philippines, where the police and law enforcement has raided families and places where this kind of cyber bullying is being manipulated from. I have not received many reports about South Africa, but in the US, we know that has increased. In Spain, we also have had that experience as well as in France.
All right. You wrote something recently where you talked about COVID-19 providing us with an opportunity for radical positive action to redress long-standing inequalities in multiple areas in women's lives. Tell us about your thinking along those lines.
Well, I was saying earlier on that Women are the majority of frontline health workers, and they are providing essential services. But actually, they are also at a very low level, which means that they don't earn much. We continue to have unequal pay and underpay and non-recognition. This is the time to really correct that, because we need to provide women with the security so that when they do these jobs, they know that they're actually secured and they can receive the benefits that they need. So representation of women at senior level also is quite critical, because they are not involved in making decisions that are critical for shaping the response, and they have a lot of contribution to make. So representation as well as recognition is something that we can address. We also have seen in this pandemic the inequalities. Many of the people who are hit the hardest by the pandemic, who are struggling to observe the lockdown, are food insecure. We really have to address the issue of poverty and access to food for families. Many of them are homes that are headed by women. We also have challenges of water and sanitation. This is a target that was set in the NDGs. We are now 5 years of the SDGs, and we have not hit the target. And when it comes to water, sanitation, and hygiene, these are the three things that make the quality of life of women better. It keeps girls at school because they have sanitation facilities, and this is one area that also is going to need attention. We also need women as scientists and innovators, because there's a lot of science that is relevant when we deal with this issue, but throughout life. There's also an opportunity, a unique opportunity, to leapfrog into the fourth industrial revolution as a result of this crisis. Data must fall, for instance, in South Africa, so that many people are able to take advantage of online learning. We must equip our teachers to use technology to learn and teach in technology. We must not make them feel that they are useless as a result of technology, but we must equip them to use technology better, and we must also equip the students. So there are many of these problems that we have been dealing with, threats, that we can actually address in a big way. But I'm also aware that countries are going to be struggling with money. Many of them will not have the fiscal space to move, and that is why we are also calling for debt relief in order to give countries a chance to survive this crisis.
All right, Dr. Phumzile Mlambo-Ngcuka, we're going to have to leave it there. Thanks very much indeed for joining us on the line this evening. That was the Executive Director of UN Women speaking to us this evening. All right, let's move to Zimbabwe, where we're just receiving some breaking news now that a third COVID-19 death has been announced there. So the death toll in Zimbabwe up to 3 now, and we'll keep you updated on that issue as it continues to unfold. And we stay in Zimbabwe, where many Zimbabweans are now questioning where their government is fully prepared to respond adequately to the highly contagious novel coronavirus, COVID-19. This comes after the second COVID-19 related death was reported 4 days after the fact. And you've just heard, of course, there's a third now. There's also panic and outrage, delay in updates from the health ministry. Zimbabwe has only registered 11 total cases so far, with 3 people dying as a result of the viral infection. Effort Musekiwa and Noma Bolani filed this report.
Zimbabwe has recorded its second coronavirus-related death, this time in the country's second largest city of Bulawayo. The 79-year-old man, who had no history of foreign travel, died at the weekend after being hospitalized. The health ministry only revealed information of his passing on Tuesday. Apparently, this was due to the man's test specimens being sent by road from Bulawayo to the only testing center in Harare.
This case first presented to a health facility on the 23rd of March and was symptomatic of COVID-19. So we think that at that point in time, a COVID-19 diagnostic test could have been done. Unfortunately, this could not be done because of the limited testing capabilities that we have in Zimbabwe at the moment. Then secondly, this patient also came back to the healthcare system when he was admitted on the 2nd of April. And we see that it took a total of 5 days for the result of this patient to come back and confirm that indeed the patient was suffering from COVID-19.
Across the country, there's growing outrage over the low testing rates. Zimbabwe has tested less than 400 people for COVID-19. Medical experts fear that the low numbers explains why the country has only confirmed 11 cases so far.
We call upon the authorities in Zimbabwe to do the following. Number one, we call upon them to urgently increase the testing capacity for COVID-19 across all regions of Zimbabwe.
Government denies that the cases are understated and that it's doing everything in its capacity.
The Interministerial Task Force is seized with making sure that we decentralize the testing. We do not want people to come from Zarabani to come to Harare for testing, neither people coming from Mutare coming to Harare for testing. So what we have been doing, you have seen that members of the task force have already gone to the provinces to talk to the provincial ministers who already, after the pandemic was actually pronounced as a pandemic by our president, they actually activated the civil protection units committees who had already started working on actually identifying isolation centers in their areas, whether it's all the way up to the districts.
The Zimbabwean government has launched an appeal for $2.2 billion, which will go towards the containment of the COVID-19 pandemic. Noma Polani, SABC News.
All right, so that's the situation in Zimbabwe. And just to give you an update on the global situation at the moment, 1,400,664,852 people, so 1.4 million essentially, people confirmed with the coronavirus, 85,000 deaths recorded. But one figure we don't often talk about is 288,000 people have recovered from COVID-19. So this is something we'll continue to monitor. But it's affecting everything. In fact, business is one area that we all know too well here in South Africa. But they say that necessity is the mother of all inventions, and nowhere is this clearer than in the streets of Nairobi, where faced with the possibility of a total lockdown if they do not adhere to rules set by their government to contain the spread of COVID-19, city residents are quickly adapting to a new life there. A life of washing hands regularly, sanitizing, and most recently wearing face masks, even though, as our reporter Sarah Kimani found out, it's not always easy to remember to keep the mask on the face at all times.
Every day, Samson Waithaka rides into the Nairobi Central Business District, stations his bicycle at a strategic location where passers-by stop for a quick hand wash and sanitize, all for free. I decided to use this time as my work is close to sensitize Kenyans on simple things we can do to contain the spread of coronavirus in our city. This week, during his daily updates, Cabinet Secretary for Health, Mutahi Kagwe, announced that it would now be mandatory for Kenyans to wear face masks while outdoor.
It is critically necessary that every Kenyan wears a face mask whilst in public spaces. Everyone must make the effort to get a mask to protect themselves and others, as we endeavor to provide them some where we can, free of charge, through our county governments and other partners.
On the streets of Nairobi, the response is mixed. Some have the masks on, others do not. Others have them on, just not on the face. Across the city, masks are the hottest selling items. The profit margin, the hawkers say, not as high as they would have wished. Everybody is selling masks, meaning we are spread out thin in terms of how many pieces one can sell, and so our profits very little. The U.S. Center for Disease Control, the CDC, recommends the use of cloth face coverings in settings where other social distancing measures are difficult to maintain. Now, retailing at between $1 and $2 per mask, some Kenyans say the cost is out of reach at a time when they must make the difficult choice of whether to feed their families or protect themselves from infections.
If they are saying 100 shillings, I can't go to buy a mask at 100 shillings, then I forget about buying unga.
The World Health Organization says masks should be seen as an additional measure and not a replacement for other prevention measures, especially social distancing. Sarah Kimani, SABC News in Nairobi, Kenya.
From Africa, we go to the United States, where President Donald Trump has acknowledged that racial disparities, particularly in the death toll from COVID-19, point to African Americans being disproportionately affected. As the United States suffered its largest daily death toll of close to 2,000 people, evidence showed that Black Americans are dying at a much higher rate than any other demographic, as preliminary data points to disparities in health and access to healthcare. And amidst signs that the outbreak is beginning to plateau in hotspots like New York, President Trump is now threatening to withhold funding from the World Health Organization.
Black American communities are being hardest hit by coronavirus, and it's now a matter that has caught the president's attention.
And we're actively engaging on the problem of increased impacts. This is a real problem, and it's showing up very strongly in our data on the African American community, and we're doing everything in our power to address this challenge. It's a tremendous challenge. It's terrible. And provide support to African American citizens of this country who are going through a lot. But it's been disproportional. They're getting hit very, very hard.
In the state of Louisiana, African Americans represent just above 30% of the population, but account for 70% of that state's dead. Illinois, 14% of the population, 42% of the dead. In its largest city, Chicago, 32% of the population, 67% of the dead. In Michigan, black people number 14%, but represent 41% of deceased there.
And then I'll continue.
A trend being observed in different measure across the country.
We have a particularly difficult problem of an exacerbation of a health disparity. We've known literally forever that diseases like diabetes, hypertension, obesity, and asthma are disproportionately afflicting the minority populations, particularly the African Americans. Unfortunately, when you look at the predisposing conditions that lead to a bad outcome with coronavirus, the things that get people into ICUs that require intubation and often lead to death, they are just those very comorbidities that are unfortunately disproportionately prevalent in the African American population. So we're very concerned about that. It's very sad. It's nothing we can do about it right now except to try and give them the best possible care.
As officials begin to point to promising data of a decline in hospitalizations, ventilator intubations, and the need for ICU beds, President Trump has threatened to withhold funding from the UN's health agency over possible missteps and failures that his administration, and him in particular, have been accused of. Washington is the top donor to the World Health Organization at over $400 million of its $6 billion budget, with President Trump accusing it of being China-centric.
World Health Organization, because they really are, they called it wrong. They called it wrong. They missed the call. They could have called it months earlier. They would have known. And they should have known. And they probably did know. So we'll be looking into that very carefully, and we're going to put a hold on money spent to the WHO. We're going to put a very powerful hold on it, and we're going to see. It's a great thing if it works, but when they call every shot wrong, that's no good.
disproportionately affected by.
When challenged about withholding funding during a pandemic.
No, maybe not. I mean, I'm not saying I'm going to do it, but we're going to look at it.
Amidst Republican calls for the WHO Director General Dr. Tedros Ghebreyesus to resign, AU Commission Chair Moussa Faki Mahamat tweeted his surprise at the campaign by the US government while calling for a united global community in the fight against COVID-19. Other African leaders, including Namibia's President Hage Geingob and Rwanda's Paul Kagame, quickly backed him. Sherman Briceby's SABC News, New York.
Using the COVID-19 pandemic to score political points is dangerous and will only cause more deaths. World Health Organization Director General Tedros Ghebreyesus said earlier today after President Trump criticized the WHO and its relationship with China.
I said it many times. We're losing people. Why would I care about being attacked when people are dying? Compare the two. We're losing lives every minute. Please remember, more than 60,000 deaths. I'm not sure if that number is accurate. I would expect that estimate that we have more deaths. Why would anyone in the right conscience think about his personal attack, ignoring the bigger challenge we're facing as humanity? My focus is saving lives. We don't do politics in WHO. We don't. We care for the poor. We care for those who are vulnerable. And we regret when we lose lives. That's where we should focus. I'm an individual. I'm no better than anyone who is suffering from COVID. I don't care who says what about me. I would prefer to focus on saving lives. No time to waste. How many more deaths would I like to see? I can't. Why would I worry about myself when the number of deaths is increasing? Who am I to make my personality before the deaths of all around the world?
That's a very defiant WHO Director, Tedros Ghebreyesus, speaking a little bit earlier on from Geneva. Well, SABC News correspondent in New York, Sherwin Briceby, has been following this story for us and joins us now via Skype. Sherwin, thanks very much for joining us. The WHO Director General seems like he's just had enough now.
And as firm a repudiation as you will hear from a UN official. Remember, the WHO is essentially the UN's health agency, Peter, and I think we all sort of sat up straight in our chairs when he was delivering or speaking during that Geneva press conference earlier today. And we are about 1 hour away from the White House Corona Task Force's daily press briefing, which is headlined by President Donald Trump. And we expect that those questions, or certainly quotes from Dr. Tedros Ghebreyesus, will be put to the president, and expect a counterpunch from this president, who has already threatened yesterday in that press briefing to put a stronghold, quote unquote, on funding from the United States. About $500 million of the WHO's $6 billion budget comes from Washington, from the United States, threatening to put a powerful hold on that when challenged by a reporter in that briefing whether it was a good idea to put a hold on funding to the WHO during a pandemic. The president then said he never said that, and that all he said was that they were thinking about doing it. So we'll certainly be looking forward to hearing what President Donald Trump has to say in response to the WHO DG.
All right, to unpack this China-centric comment that the President Trump made, accusing the WHO of being too friendly or helping the Chinese far too much. What's all that about?
There is a broader narrative, certainly in terms of multilateral institutions, particularly affiliated with the United Nations, Peter, in that with the United States, America First ideology perspective that has been driven by President Trump, other countries, particularly China, the second largest economy in the world, will fill that gap, that void left by the United States, moving away from multilateralism and adopting a more unilateralist approach. So that is a broad conversation that we can have another discussion about another day. As it pertains to the WHO, you will remember very early on in this crisis, they were very reluctant and continue to be reluctant to apportion any blame to Beijing, to Chinese authorities for their initial handling of this. They don't believe that pointing fingers is the right thing to do right now. They will talk about this when they do a post-mortem. Once the issue of saving lives has been addressed. That seems to be what the philosophy of Dr. Tedros and his team has been. We don't want to accuse people. We don't want to point fingers right now because the crisis at hand is a public emergency that needs to be dealt with. He has also been asked about domestic criticism that has been leveled against President Donald Trump here. Of course, intelligence agencies revealing that they had briefed the president in early February. His own White House trade advisor had warned that this pandemic could cost trillions and affect millions. And still you saw the president not sure what to do, talking about how this was a crisis that was just going to disappear. So there is a sense that the WHO does not want to criticize. Tedros didn't criticize Trump. He has not criticized President Xi. And that tends to be how the UN runs its ship. It essentially doesn't want to get political, wants to focus at the job at hand.
I mean, is it far-fetched to think that there's a president who's looking at an election on the horizon, accused at home for acting too slow, that he's deploying the oldest trick in the book, which is to deflect, deflect, deflect?
This is not just a strategy from President Trump. Remember, members of the Republican Party, various senators, 3 on my count so far, just in the last week, have been raising these issues about the WHO. So this has been building for the last week. When we saw the president sort of affirm what his colleagues in the Senate have been saying, there's calls for a congressional investigation into the handling of this crisis by the WHO. We heard from Senator Lindsey Graham on one of the networks the other day talking about how he's in charge of the Appropriations Committee in the Senate and that he's going to push that there's no more funding for the WHO. We saw a senator from Arizona, Senator McSally, talking about how Dr. Tedros has to resign. So this has been building, and the president talking about how they might withhold funds. This seems to be a GOP strategy. This seems to be an election ploy to deflect criticism that you're now seeing from Democrats as to what the president did or did not do, or what his administration did or did not do. And the focus is now this international organization. When the president was speaking about how, they didn't tell us and how they should have let us know, he had information on his desk. He received daily briefings about this virus and warnings about what was to come, and talked about, how it was going to go away when the weather got warmer. So it's certainly a deflection, and very much, you correctly point out, an election ploy.
So how has he been able to explain the accusations that he knew much earlier than he's letting on?
Well, I mean, in the briefing yesterday, I mean, you see the strategy of this president, and you can play the tape back. He says one thing, and then he says he didn't say it when he's challenged on his own words. If you literally played back the tape of what the president said, he will say he didn't mean that, or he didn't say that, or that's fake news, and it's the media that's trying to get him. So this is a president that is very nuanced in his ability to deflect, and is very much a performer. I mean, when the lights go on, it's action. The president is very much up to the task when it comes to those sort of battles that he has with the media. He's also talked about the fact that the reason he downplayed the virus at the beginning, Peter, was because he's essentially the cheerleader for the United States, and he didn't want to create panic. So that seems to be one of the explanations as to why the response was so measured and so slow at the beginning from the federal government.
All right. And I wonder if that is that part of the reason why the WHO Director General was at pains to explain the work that the WHO had done since the pandemic broke out, just to lay the ground to say, look, you can say what you want to say, but this is what we've done.
Yeah, and I mean, this was really... we're not accustomed to seeing UN officials defend themselves in such a specific way. I mean, he gave very specific examples about how he was attacked from certain regions of the world, calling him a Negro and, you know, talking about his race and maybe the associations of incompetence that go along if history is our guide. I mean, we talk about black people historically. So he'd had enough. And I think just the long hours and the pressure that you're under in the midst of a coronavirus epidemic, Peter, he was certainly standing his ground, and you will have noticed that he had received support from the likes of Rwanda's president, from the likes of Namibia's president, from the AU Commission chair. So maybe there was a discussion, certainly among African leaders, to say, you know, let's not let the president of the United States get away with this one.
We spoke to South Africa's ambassador to the UN a little bit earlier this evening, and I'm just wondering the dynamics within the UN Security Council, because they're going to have to speak now about COVID-19, and there's a jostling for the language. And I just wonder, as a journalist who covers the UN and the UN Security Council, what's going on behind the scenes, what's at stake, and what's likely to come out?
You say they have to, Peter, but will they is still a question we ask ourselves. There are these two competing resolutions. The E10, the elected 10 members, have a resolution basically that would endorse this call from the UN Secretary General in terms of a global ceasefire. And then the P5, the permanent 5, have their own text that has not been shared with the other members and that they are negotiating. As you correctly pointed out to Ambassador Machila earlier, you know, what could be so difficult about this? Look, I mean, a lot of the stakeholders in the council are parties to various conflicts around the world. You'll know that Russia is a big supporter of the Assad government and the war in Syria, and various other P5 members have a finger or a knife or a fork in the pie somehow. So it's very difficult in the current makeup of the UN Security Council to reach consensus on anything, let alone calling for a global ceasefire on all the conflicts that are happening around the world. This is a big ask for a council that is known for its ineptitude and its inability to reach consensus on a variety of issues. So I wouldn't be too optimistic. And if there were to be a draft resolution, it will probably be some watered down version that probably won't really impact what's happening on the ground. Just today, an agreement of a ceasefire in Libya was violated with bombs and, the Secretary General condemning the escalation around Tripoli. So let's look at what's happening on the ground and whether the Security Council will now act.
All right, very briefly, I can't resist. We keep forgetting there is an election coming up, and there's big news from the Democratic camp today.
Yes, the Democratic Socialist Vermont Senator, former candidate in 2016. I'm trying to drag this out because you told me to hurry. Bernie Sanders has dropped out of the race. He gave a speech to his supporters earlier. He's endorsed he will support Joe Biden, who is now essentially going to be the nominee for the Democratic Party. And you'll remember that, he stayed in the race quite late against Hillary Clinton in 2016. They say that part of her losing the election was because he hurt her chances. The real test for Joe Biden is going to get Bernie supporters, who are very fervent supporters, behind his more centrist agenda. And it's going to be a test of how much Joe Biden and his campaign can reach out to the progressives, the progressive wing in the party.
Sean, thanks so much indeed. Stay safe. Great talking to you as always. And that is how we come to the end of this edition of African Perspective. Take care. Stay safe, everybody. Stay at home.